My name is LaDonna Kearse. The title of our paper is Diversity, Equity, Inclusion, and Presidential Leadership of Academic, Medical, and Surgical Societies.
Hi, I'm Dr. Carla Pugh. I'm a professor of surgery at Stanford.
The aim of our study was really to understand the diversity that's present in the national, presidential, and academic society standpoint. There's been a lot of work that's looked at diversity in the pipeline, increasing diversity for medical students and residents, but not much work into the society presidents and how that's reflected kind of higher up the pipeline. So for these organizations, we looked at both when they had their first gender and racial diversity. So their racial diversity was defined just as having someone who was an African-American for this purposes of our study. And what we found was that the majority of societies actually diversified via gender first. And then the kind of a 28% diversified via race first, and that was typically represented by an African-American male president. We also saw that a lot of the societies were, again, gender first, but when we looked at actually African-American females and whether or not they were kind of holding these positions of leadership, we found that most organizations have not had their first African-American female president as of yet. And for those who did, that was around 9 years ago. So relatively recent that we've seen that. And actually, I guess after publishing our study, we also found that there's going to be an African-American president elected for a surgical society coming in 2023.
And I think we should underscore, she will be the first, Dr. Pat Silla will be the first African-American female president of a major surgical organization. And that just happened last year.
There's been a lot of work in terms of diversifying the pipeline, really kind of targeting individuals who are at the beginning of their training, but that needs to be reflected at the higher levels as well. It's important for mentorship purposes and also for continued diversity to have that reflected at a leadership and any type of academic positions as well.
We are helping to bring the unconscious to some level of conscious awareness, which then gives us an opportunity to openly talk about it.